there are many approaches to removing the tonsils. Some you just remove the tonsils. There's some that open it up and they burn out the center part. And there's one with radio waves. Sure. Can you talk about them?
Sure. There's the three main ways we're referring to are using bovicautery, which is an electrocautery device that cuts and coagulates, or cuts and cauterizes the surface at the same time. And that's been the method that's been used for many years and is still used today. Coblation is a new technique, which is a type of thermal coagulator that is able to remove the tonsil, and it's thought to be slightly less traumatic. However, there's studies that support one way and the other. There is also something called an intracapsular tonsillectomy, where the inside of the tonsil is removed and the shell of the tonsil essentially is left in place. And this is usually indicated for obstructive sleep apnea, and when you're doing tonsillectomy for that. In infections, it's less done.
What are the risks of doing a tonsillectomy surgery?
The main risk of tonsillectomy would include pain. Just about every person who has a tonsillectomy has some form of pain, and as you get older, the amount of pain you have is usually a little bit longer. Infection, which is always a risk with surgery, is very rare. Most doctors place their patients on antibiotics post-tonsillectomy. The main risk, which is rare but is significant, is bleeding. And that, depending on the studies you look at, can range anywhere from 2% to 8%. And it happens usually more frequently with tonsillectomies that are performed for chronic tonsillitis or chronic infection.